Hi, my name is Dr. Michael Rybczynski from Lancaster General Health. When I think about the way doctors are accessing medical applications as well as patient data now, a couple of the keywords come to mind like value and convenience. It's really valuable for them to have access to that record, especially electronically, so they can continue to care for their patients even in the off hours. It's also convenient to have that so that they wouldn't have to travel back to their office or even travel back to the hospital to initiate or continue care for their patients. I look at a lot of our physicians on the medical staff and they're using cell phones and tablets to really find patient information quickly, be able to interact with the patient's chart while they're on the go, and be more connected to their record than they were when the record was on paper. There's also applications to help do symptom triage, or basically, try to figure out what the patient would need at that particular time. A lot of my physicians also use online reference material, whether that's for medications, to look up drugs for prescribing them to the patients, or on diseases and being able to look up and access medical information at the point of care. When I see patients as a family physician, I often prescribe apps for them to use at home. And one of the biggest apps I prescribe them to use is access their own chart, because that's one of the biggest ways that they can engage in their healthcare to start with. But we've also tried to prescribe other apps for them in terms of wellness or fitness, or even just be able to track their diet or even their sugars online. I get tons of reviews from them saying how great it is to be able to see their test results, or to just avoid a phone call when they want to just schedule an appointment or request a refill. And as we see them sort of interact with these medical apps, it's really helped them to improve their healthcare, because it's exciting to do and easy to do while they're doing it on their phone or on a tablet.
Like many other things these days, the apps are rated. So when you first look at an app, if you do a search, several apps will come up, and you can see how many people have used it, what they thought of it. So usually I only take ones that are like 4.5 stars and free, which there's just so much you can find. And if you really think there's something you like, you pay a little bit of money, and for most people it's really not that much money. They're usually under $5 and often under $1. There's more and more studies on lifestyle. If somebody watches TV more than 4 hours a day, they're more likely to die early, and that's very significant. If somebody eats more sodium, their sodium-potassium ratio is higher, they're more likely to suffer sudden death. We know that, and we have had a difficult time decreasing sudden death. So if we can get these kind of messages out there, and people can track their sodium intake, track their blood pressure, exercise, they're going to live longer. I have an app on my phone for checking my pulse. There's an app for improving your memory for people having memory problems. There are applications if you have cancer, especially for people with a rare cancer. You can go on this app and search for cancer trials within 150 miles.
Part of the exciting piece around the patient accessing their record on a mobile app is to be able to review all the preventative maintenance that they may need, whether that's for colon cancer screening, breast cancer screening, or immunizations. Those have been real important for our patients, because we've realized and had patients now come in as a result of seeing those notifications in their mobile app to ask the doctor and ask me, hey, I saw that I'm overdue for this. Can you sign up and get me that? So it's been really a valuable thing for my patients. I think one of the biggest values of having the patient access their medical information online or via an app is really to help enhance the record that we have for them. Because oftentimes they've gone from physician to specialist to cardiologist to pulmonologist and back to their primary doctor. And oftentimes the records were not in sync with one another. Now we have a chance to basically have the patient engage in that record and improve its accuracy via the medical app. For those people that are hesitant for using an app, I often just try to show them an app in the office when I'm seeing them. So, I might pull out my own smartphone, and show them, how easy it is to access the record. And, really it shouldn't be very scary to try to use these apps, because it can provide, great information to them. So just breaking that barrier of showing them how easy it is to use has really been helpful for me. We're in this together.